Hi, I'm your host, Marsha Florence for Just Ask Podcast Live. Thank you, ladies and gentlemen, for joining us on our Thursday afternoon special. As usual, I always like to fill you in on what's going on in the community, around town, throughout the state of Michigan, and beyond when we have news to share. Okay, so sometimes we have to bring some of our guests back because they have resources and information that we like to make sure that you stay privy of, that they come across during their line of work. So the person that you'll see today, Ms. Pat Rencher of the Urban Aging News. Pat is coming to us on a quarterly basis to give us an update of services that she comes across in the Urban Aging newspaper. Now, for those of you who don't get the paper, today after you get a chance to see the interview with Pat or our usual discussion, you might be interested in wanting to get this paper so that you can connect with some of these agencies and services that are in that paper. Along with, if you don't have access to a computer, the paper you can receive the paper online, or you can call Pat's number and order the paper, and the paper will be delivered to your home, or you can find out what other locations the paper is being distributed at. So without, as I usually say, further ado, we like to say hello to Miss Pat Rencher, publisher of the Urban Aging News. Good afternoon, Pat.
Hi, Marsha.
Good to see you as usual.
Good to see you as well.
Okay. Now, Pat, I was just expressing to our viewers about the Urban Aging newspaper, and we might have some new people who just came on board. So tell us a little bit about the paper and yourself.
After working in geriatrics at Wayne State University at the Institute of Gerontology, and ushering both of my parents through their golden years, the ups and downs of skilled rehab and nursing homes and navigating the healthcare system, I realized that most of the adult children that I met along the way had no knowledge of any of these systems. Mm-hmm. And so I decided I was going to start this paper. So 6 years ago this month is when I started the paper. And the paper is directed to older adults in Metro Detroit, as well as their family caregivers or service providers, to supply them with tangible, actual occurring events and services and resources within the region.
Okay, well, first we want to say congratulations on your 6-year anniversary.
Thank you.
Yeah, it takes a lot of people think that when they see something, the work behind it was for over years or months, or just the time. Just like here at Just Ask, we've been around a long time, and people are just getting familiar with us, or getting used to seeing us. But if we told you how many years we've been around, they're like, no way. Okay. But we've been around a real long time. So I understand.
I know.
Yeah, I understand your hard work and putting in all that time, especially when you are the caregiver of aging parents. Everybody learns different skills. Everybody comes up with different ways for caring. And then sometimes you get to share that knowledge with other people who are getting into that style. All of a sudden, well, my parents have passed on, and my neighbor, she's taking care of her mom, and she's getting frustrated, but sometimes some of the knowledge that we have, we share with the next person so that they can help, ease some of their stress. Because I never want a person to use the word burden. Whoever you're caring for, it's not a burden. And you should always try to emphasize to your loved ones, you're not a burden. this is what I want to do, and this is and I'm asking to support and sustain your life. So I choose not to use that word burden. I never used that when I was taking care of my parents. If I had a dark moment, I just went somewhere and cried and spoke to God and came back and said, okay, now what was we doing? And that was me.
Right.
You know.
But if caregivers don't take advantage of support services and services for themselves as well as the care recipient, it can feel like a burden.
Oh yeah, yeah, but just don't express it to the loved one.
Oh, absolutely not.
Right, right.
But they
So I
can
went.
tell.
Oh yes, and that's why I always seemed like when I had to pop back into the room or something, I didn't have puffy eyes or anything. I just went back and did what I was supposed to do, or schedule it. And I think in caregiving for adults, you don't have to make it look like it's the same idea that how the formula that you use for caring for children, but some of that stuff is actually the same. You got up early when you had to get your kids ready for school. You prepared their lunch, or you had their clothes already out. Some of those same things that you do for children is some of the same things you can do for adults in preparation for the day. It doesn't mean you're going to play games and all that, but if you think that you have to lay their clothes out, if you have to prep the meals, if you have to have the medication ready, to me it's the same. It's about the same. And everybody might not feel that way, but that's how I did it. I'm like, okay, these are my two children right here. Okay, let me do what I got to do. So, but I prepared my day because I worked, so I had to prepare my day for my parents and have everything organized the night before, not the day of. And if we had additional family members or something, then that's when the support system kicked in. So, but today, Pat, we usually go over your paper. So this is the quarterly edition that we're going to talk about today. Now, is this the spring summer edition? Because I had to bring this cover sheet up.
No, I publish 4 times a year.
Okay.
And so this is the spring 2021 issue. And you'll see there one of our prized possessions in the Aging Network is Dr. Gwendolyn Grady Dansby, and she's retiring after 30 years as a geriatric physician.
Okay, now
we wanted to pay tribute to her.
That is a beautiful
which we do
picture
in this issue.
Okay, so Dr. Gadsby is retiring. Okay, so we have to get her on the show and let us tell her about her history in is it gerontology? That's what she studied?
Well, she's geriatrics.
Geriatrics, okay.
Gerontology is for the academics.
Okay. So, okay. All right. Well, congratulations to Dr. Gaddy Dansby. All right. Okay, Grant. Okay. Now we go through the paper every year, or every quarter rather, so that we can prepare the viewers to see some of the wonderful articles that's in there. And if they can use this information, it's a blessing. And if not, they can pass it on to someone that they know. So the first page I came up with was Solo Agers Plan Detroit Co-Housing Community. I'm interested in that, Pat, but I want you to tell our viewers what is co-housing. What is the co-housing community?
Yeah, so you probably need 2 definitions. A solo ager is someone like myself, someone with no children and no husband. And co-housing is a model that exists across the country. They could be where families come together intentionally. Families can come together in a co-housing model because they could have children. And they've decided that they're going to live in separate houses and maybe have a community house and look after one another. What we're proposing with the Detroit co-housing community is that you have solo agers, people who have, like I said, they could be a married couple whose children live in California. But this is to avoid being aging completely alone, that you're aging in a community where people will kind of look out for you and check in on you. Someone will know.
Well, let me ask you this, Pat.
If you're not well.
Let me ask you this. Is this will it be a community where all the housing is developed for co-housing, where individuals or couples can go? Is this going to be an area, Or is it a section of the city or something? Or has it been established?
Yes, we've got some land in Southwest Detroit, and the land is going to have all new housing or different residential settings. But this particular project is for solo agers. Each person will have their own house,
Okay.
and there'll be a community house.
Okay. Okay. All right. Well, that's
Yeah, because
understandable.
most of us are coming from living in a house all by ourselves that
Mm-hmm.
generally are not conducive to aging in.
Okay. All right.
There won't be
So
tiny houses because we don't want to live in tiny houses,
I
but there'll
bet.
be
I bet.
15 to 12, between 1,500 to 2,000 square feet homes.
All right. Well, you know what? That's a good thing because what we're looking at is that people are trying to figure out where they want to live and how they want to live. So, along with that, it makes it easier to say, well, if you want to live in a community where mostly everybody's of the same age or core group, this would be one of the places that you could go. Okay.
And
So,
you'll
but
be supported.
okay, okay. So by the time the full development of this project goes into effect, there'll be other components to it as well.
Correct.
Okay. All right. All right. Well, that's a good thing. So, I like to we just jump right into it. Uh, this page here, opinion. I am a black doctor. Here's why we all should take the COVID vaccine. I want to go straight to this because in the community, as African Americans are concerned about getting the shot and the variations of the different shots, and going back into history, what is this doctor's take?
Well, his take is that, and what he does in this article is promote vaccine usage, and he is speaking to people who are hesitant or unwilling, and he gives you the background in terms of the fact that it wasn't developed overnight and what side effects it does or doesn't have. A lot of, the importance, the reason I wanted to include it in this issue is that I don't think a lot of people have are making informed decisions. So this is just another piece of information that people can consider if they're wavering about taking the vaccine. I'm not promoting one way or the other. I'm just providing the information
Okay, so
from this
Dr.
physician.
Herbert Smitherman is, and
Yes,
I, okay, so he's actually given insight on the reasons that African Americans should take the shot, more or less.
correct.
Okay, all right, all right. So okay, well, let people get the paper, let them read that. All right, so now I switched over to aging in your comfort zone. Okay, a medical waiver program. Now, people are always trying to find ways to get their medication discount, and I can understand that. Some medications are you kidding me? You go to the pharmacy and pick up your medicine, and they tell you $40 or $50. You're like $40 or $50, but you didn't see the real bill, and the real bill was $250, but you might have to pay the 50. So, what is this Medicaid waiver program all about?
So, first of all, you have to be eligible for Medicaid.
Mm-hmm.
Everybody has Medicare once you turn 65, but Medicaid is a low income program, as you probably know, Marcia, after having worked for the state. And so seniors who are both Medicare and Medicaid eligible and others can call. We list the most of the time you call the area agency on aging, tell them that you're interested in the Medicaid waiver program,
Mm-hmm.
and they can help to see if you qualify. But allows you, this is a program where you can stay at home and receive home and community based services.
Okay. Okay. It seemed like, okay, I know people will have questions, so I just brought up our number in case people do want to call and ask questions, and we'll refer all the questions over to you, Pat, because some of the stuff we won't know offhand. But those medication waiver concerns and things like that are definitely on top. For people to be concerned with, because like I said, you go to the doctor and get the prescriptions, and I'm really sick. Then you go to the pharmacist, and he doesn't know that you don't have insurance, or even if your insurance would cover it, they make out the prescription. That's it, and then you frantic because it's a toss up between do you eat or do you take the medication? And that bothers me to know that we're concerned about, do we eat or do we take medication, when we should be able to do both. So hopefully
Absolutely.
this waiver program would be one that they can take a look at. So as usual, I'm going from page to page here. I like this one. I had a chance to read it, and it says, "Now what?" So let's fill our viewers in onto the Now What book.
Yeah, that was a project that was developed by a lot of local community development corporations, along with Front Edge Publishing. Many of the CDCs that that are in the neighborhoods used to do just youth programming or beautification projects.
Mm-hmm.
And what they're finding is that they have more and more seniors in the neighborhoods who need service and need um, advising as to what they should do. So we put this book together, and it's an overview. So I would
Okay.
give this book to someone and say, this is an overview of all the issues that you probably or most likely will confront as you age. And then I'll hand them a copy of my paper and say, these are some of the current issues. So it would be good to have both.
Yeah.
Now what? The Gifts and Challenges of Aging is the complete title of the book. But
Okay.
it's one of those books that you might want to just keep on in your bookshelf,
Well, we
because you're
had
gonna
to.
need it.
Yeah, we put your web page up and the phone number because somebody might ask about that book and then some. So it does make
Yeah,
sense
the
to.
books are on sale. Yeah, they
Okay.
are.
All right. Well, that's good. Okay, because a lot of stuff we're seeing, somebody at home is seeing it too, and like, oh man, I need to get that. I need to find out about that. So, thank you, Pat, for giving us the inside track of what these articles are. Now, this is one of my concerns: the nursing home reopening to visitors. A lot of people who have loved ones in nursing facilities due to COVID couldn't go see them, couldn't touch them. And it's sad to say that a lot of the aging family members in the nursing facilities, some may have passed on, or dementia and full blown Alzheimer's may have set in due to the fact that they couldn't communicate with their loved ones. So, what is the status now on nursing homes reopening to visitors? I mean, is there a certain pattern that they're following now, or is it,
Absolutely. And
okay?
while you can call your Michigan long-term care ombudsman,
Mm-hmm.
and people do, to get clarification, the nursing home itself will give you clarification. And what I try to do here, because the ombudsman program tells me that people are still confused about what you can and what you can't do. So
Mm-hmm.
there still is, you need to either show, for example, show having been tested. Some nursing homes may test you on the spot,
Mm-hmm.
but that's what we did in that piece, is just outline the basic guidelines for visiting a loved one in the nursing home.
Okay.
And one of the other guidelines is that unless it's what we call a compassionate care visit,
Mm-hmm.
compassionate care, is when people are making their transitions,
Right.
and you can be allowed to see them. In a regular visit, the nursing homes are asking you to maintain the 6 feet distance. With a compassionate care visit, you can touch your loved one or
Mm-hmm.
hug them
Right.
for a prescribed amount of time. So there's a lot of rules that they're applying, and they're heavily enforced, because we don't want another outbreak in any of the nursing homes again.
I just felt bad that a lot of people maybe wasn't in their position to do so, didn't bring their loved ones home, just for this time period. I mean, I know it's money on the table. Hey, this facility is paid for, but my family member's life is at stake. Someone from the outside was bringing in COVID, and they didn't intentionally do it, but the nursing homes were more wide open to get it, and because a lot of people's immune system was low, and pre-existing as the conditions are mostly in effect on them, they were susceptible to get COVID quicker. So, and then the first thing they said was, we're going to make sure we get the vaccinations to our senior residents. That may have helped, and in some cases it might have been too late. But me myself felt like, why, or was there a way or offer or opportunity for people to bring their loved ones home, even if it was just temporarily, stop the payments or whatever. But these facilities weren't going to shut down. They weren't like, oh no. But if your loved one wasn't at a severe state where they had to have tubes and things of that nature, additional care, I would have thought, for if possible, bring them home. Just if it's nothing for like 3 to 6 months, bring them home. So hopefully we can get past that now, or if someone considers that doing that, then that should be on the table. That offer should be on the table. So now, this is my favorite page, Pat. Okay, okay. I always look at who is that down there in the right-hand corner. Okay, now along with me, sitting there, and you can always, ladies and gentlemen, tune in to the Just Ask Talk Show Wednesday mornings at 5:30 a.m. or on Channel 56, or Friday afternoon at 2:30 p.m. on Channel 56. So thank you, Pat, for always keeping us in the know, and we hope the viewers will. Yeah, thank you. We hope the viewers will catch on. So you got some good stuff on this here too. So visit our new website. You got a new website going on?
Well, it's not new anymore. It'll be a year old in July.
Okay, okay.
But all the issues of the paper are on the website.
Yes, they are.
So we do two things. We always have print copies of the paper. We're committed to making sure that there are handheld issues, and because of COVID now, we're sticking them in all kinds of Focus Hope boxes and community-based organization boxes and that kind of thing. But so you have a choice. Either you can go online to read the paper, you just subscribe, you put your email address in there one time, and or maybe there's a place.
Sorry. We got your information at the bottom of the screen too. So for those who couldn't see that photo, which was still a large photo, we do have is it info@urbanagingnews.com?
Yeah, but it should be urbanagingnews.com.
Yep, that's what it is.
Is that on there? I can't see that.
You got two of them. Okay, so definitely, we'll bring that flyer back up so people can definitely take a look and get that urbanagingnews.com. www.urbanagingnews.com. Okay, so like I said, if someone calls in, we'll definitely make sure we get that information over to them. Not a problem.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
Honey, what I think you need is a socket wrench.
I played JV basketball.
I'm sorry. I don't think it looks right.
This is good, and it's all good, baby.
Is it really all good?
If you love me enough to routinely test your handyman skills, not to mention the strength of your marriage, then of course you'll visit nhtsa.gov/the-right-seat to make sure I'm in the right car seat.
I'm gonna call my dad.
If you love them enough to do this, surely you'll check nhtsa.gov/the-right-seat to make sure they're correctly buckled in the back seat.
All right. So, Pat, on my page 19, phone calls keep seniors connected. I like this one. Tell us a little bit about that.
Yeah, the program is called Telephone Reassurance. Once again, going back to those solo agers, I read a statistic earlier that there was some astronomical number of older adults that are aging by themselves. And 80-year-olds, 90-year-olds. And so several organizations have what they call a telephone reassurance program. And so you can enroll yourself. Someone who is concerned about you can enroll you. You can get enrolled through the state. Okay. And then I list several agencies that someone that loves you can call and enroll an individual into the program to receive a phone call. And the phone calls could be anything from just a wellness check, how are you doing, to, people are talking about gardening and sports. Yeah, but it's a welcome piece of socialization for people who are socially isolated.
Okay. I hope somebody takes that in consideration. That's a wonderful thing. I remember being a kid and we used to go to the lady at the corner's house, and she was by herself, and we knock on her door, and she always give the kids candy, of course, but, she just loved to see us come and sit down on the porch and eat an apple, and just talk to her, and she asked us what grade we're in and who combed your hair, just general conversation. And I know this generation doesn't do that, but just knowing, like you said, if you can make a phone call to an elderly person and just cheer up their day, that's a wonderful thing, too. I'm not going to say open your door to them, but, to a young person or anybody, really, but at least at a phone call conversation, you feel connected.
I agree.
Mm-hmm,
Yeah.
mm-hmm. So on this last page, Pat, this was, always kind of like a heartbreak page, but it's a very important page, elder abuse. It breaks my heart to know that somebody would mistreat somebody of an elderly nature, but it does happen. So here with the elder abuse, I see there's a phone number for contact at any time, and it got 2 numbers. So, Pat, just briefly run over that for me for our last few minutes.
So basically, any area agency on aging in southeastern Michigan has some form of an elder abuse program. And you can call the area agency on aging, tell the information and assistance person who picks up the phone that you're concerned about someone. They will direct you to whoever in their agency handles that, or they may direct you to Adult Protective Services. Sometimes people even make anonymous complaints, be it financial or physical or emotional abuse that the older adult or the person who's calling feels that the older adult is experiencing. It's a wonderful thing to be able to monitor our loved ones or someone we're concerned about.
You know what? You can stay
and
anonymous.
The authorities take it from there.
Right. You can stay anonymous. Just make the call. Just because, you see something happening, you don't have to turn your head, and the neighbor doesn't have to know that you reported them. You just making a phone call saying, maybe you guys want to check this out because I hear this, person crying through the night or something like that. So I think a lot of people should stop being so fearful of thinking that they're going to know it's me. Well, when the person died, they still gonna know it's you because they said you could have called and said something. You could have did something. So I like it when people, even if you have to stay anonymous, tell. Go ahead and tell.
And Marcia, it doesn't have to be that you think someone else is bringing harm to the older adult. It could be that the older adult themselves is self-neglecting and needs somebody to step in.
True that. Well, Pat, our time is up, and as usual, you always give out a wealth of information. We put that information up again. So, ladies and gentlemen, definitely, if you want to get this quarter's paper, there is on the cover is Dr. Gaddy Dasby. So that's the new edition that just recently came out. And beyond that, if you need to contact Urban Aging News, there's the phone number and the web address down below, and Pat Rencher, publisher, will definitely take your call. So, Pat, will you come back and join us again on the next quarter?
That'll be summertime. Absolutely.
Okay. Well, anytime you want to pop in and tell us something, you can.
Will do. Thanks for having me.
All right. Thank you. Well, ladies and gentlemen, you know who I am. I'm your host, Marsha Florence with Just Ask. And what do I always say? If you know a person with a disability or if you just have a general question, don't be afraid to ask. Just ask. And don't forget to check us out every Wednesday at 5:30 a.m. or Fridays at 2:30 p.m. on Channel 56. I'm your host. Thank you. See you next time.